Okay, so I guess Rebecca is just going to be, at least for right now, Joseph Ray, who's at Laguna Rainbow in New Mexico. So he did not sign the MOU, but he's been very, very involved. And then Julie. So why don't you guys go ahead and just talk to Joseph, and I'll take some notes because I send minutes out so we can get the updates that way.
And this is Don, who's joined the call now.
Oh, hey, Don, good. I'm glad you're back. Sure. And Rebecca, if you want to stay on the call to listen, or Julie, to what Don is going to talk about, he's our guest speaker, and he's a social worker up in Fairbanks. But we asked him, Lisa Johnson thought it'd be good if he talked to us, because he's done so many amazing things with connecting with leadership and community, and we thought that just to kind of hear his story and how he made that happen might be a good starting point for a best practice. So I'm going to go ahead and let Julie start first with CMS.gov, and she's going to give us a little update on the best practices report.
Okay, thank you, Debbie. Hi, everyone. My name is Julie Cahoon. I work for Kaufman Associates, and we work with the Centers for Medicare and Medicaid Services to host a technical assistance center online. A new addition to that technical assistance center has been a section for tribal nursing homes, specifically for the U.N.I.T.E group. And so that section has a number of different elements on the page, like the conference calls. Each call is recorded, and we post it online or onto the website so the public can access it, just to kind of get an idea of what's discussed and stuff like that. It's closed to just the group members only, though. Also included on the page is just an overview of the tribal nursing homes, a directory of the tribal nursing homes, who basic contact information for each of the homes. And also on that section is a best practices section where we will begin developing a series of best practices reports that will be put out quarterly. We had our first report that was based on the traditional foods in tribal nursing homes that we submitted to CMS in December, and that should be live on the page, I think, within the week. Which is very exciting.
Okay.
Yes.
Okay. And so I sent that out. I sent the document you gave to me out to everyone. I hope you all did receive that. Did everyone receive that, Joseph? Did you receive that?
I can't recall, but when did you send that?
That was before Christmas. Julie, I think that was before Christmas when you sent that to me, right?
Yeah, or it was, I think it may have been, I can't recall, but it was recently.
Okay.
But
all right.
So that we're working on getting that document posted live, and so that will also be online within the U.N.I.T.E section of the Technical Assistance Center. Next, we are working on the next quarterly best practices report, which will focus on, or let me back up just a little bit. So what we've decided to do is each year we'll focus each of the quarterly reports on topics that are decided by the U.N.I.T.E group. And so during the November meeting, November in-person meeting that you all had, the topics were communication with tribal leadership and dementia care best practices. So what we're hoping to do for this year's series of best practices reports is to highlight those two topics. So for the March 2017 best practices report, what we'll focus on is dementia care best practices, factors that nursing homes need to consider when implementing care into their homes. And then for the June 2017 report, we're hoping to focus on communication with tribal leadership in the healthcare field, how to approach leadership in conveying the needs of your programs and your institutions. And then the September 2017 report would be a combination of both of those. How would you talk to your tribal leadership to get dementia care best practices within your care system? And so just a broad overview. We're definitely always seeking input from members as far as how to best approach this report, how to approach these topics, what areas we would need to consider in developing the report, and just any general information that one might provide. Debbie, did you want to add anything else to that overview?
No, and I mean, Julie and I just spoke right before this call, and so we're kind of, because we picked two topics for this year, one clinical and one clinical, one clinical, one non-clinical. She's suggesting that we kind of do these best practices reports like almost like in 3 phases. So if you didn't kind of catch that, so the March report will be more on like kind of the background on dementia care in a tribal nursing home, and then factors, to think about, if you're going to try to have good dementia care, how is that going to look? And then the second part, like she said, the report in June then would be on more how we communicate, how we engage our tribal leadership, how we engage our boards, our communities, whatever. And then the third part, we can put those two together. So now we know what looks like good care. We know kind of how to this communication piece. How do we then use that? How do we use that support that hopefully we're working on developing to get what we need to provide the best care possible? And I don't know, Julie, there's actually a 4th report. What would that be? Do you want to even talk about that or not?
Yeah, and so, and I totally spaced that. So there would be this December report as well. And so for that report, I think we could maybe just tie in, not necessarily anything that was left out, but throughout the year, folks will be, I believe U.N.I.T.E will be working on discussing policies and whatnot. So maybe the last part of the year could be a summary of what the U.N.I.T.E group had been working on during the year.
Okay, that would be good. We could just do kind of an overall summary. And then, okay. And can you remind us when we agreed to do the webinars? Do you want to pick those topics now?
Yeah, so for the webinar series, excuse me. So we when we developed the schedule just recently, we revised it slightly, and we have. Let me just pull up that document really quick. I don't want to misstate.
Was it May and June? I want to say May and June, but that might be wrong.
I feel. Okay. So for this year, Debbie, it looks like we have June and July. But if you would like May and June, that's fine as well.
No, that's fine. No, we'll stick with what we had. I think that was right. It was June and July. So we were thinking we would almost do like a part 1 and part 2. So by the time we get to June and July, that's the 3rd, 4th Wednesday of every month, we should be able to, like part 1 could be kind of what this best practice report is about, right? I mean, part 1 would be the dementia best care practices, and part 2 would be, the work that we've done on how can we have better relationships with the leadership so that we can make these things happen, right? There's a pathway there for these things to actually be implemented. So that would be the webinar part 2, Julie. What do you guys think about that? Does that sound okay, Joseph?
It does sound like a good plan and a good path, yes.
Did Val, are you on the call by any chance? No? Okay. All right, that's fine. Anything else, Julie?
No, those are the only updates that I had on my list.
Okay. So if you guys haven't gone on, it's cms.gov. You go to Outreach and Education, and then you go to American Indian Alaska Native, and then you go to, what is it, Julie, the Tribal Technical Assistance Center, right? And then you'll see the link for the U.N.I.T.E website. So if you click on the link for our website that our IT person created, all the things that I post on the Google, like everything I send out to you, feeds onto that website. So if you lose your minutes or something, go on to our website and you can get it all right there. So it's just tribalnursinghomes.weebly, WEEBLY.com. Right, Julie?
Right.
Yeah. tribalnursinghomes.weebly.com, and all this stuff that I'm putting out, that we put out, the minutes and all that stuff, it's fed onto that website, so you can look at all the correspondence that's been sent out. So, Julie, I never did get any transcripts, and I looked on the website. It looks like not all the transcripts have been kept up to date for our monthly calls, but even like our annual meeting, I never got a transcript from Jonathan.
Yeah, I spoke with our IT person who does the recordings and just coordinates the transcripts, and we are still working on those, but we should have them all ready shortly.
Okay, just so you know,
for the transcript for the meeting, Debbie, the recording quality was not as good as we had hoped. So the developing the transcript has taken longer than anticipated.
Okay, that's fine. So for those of you who weren't at the second annual meeting in Minneapolis in November, Jonathan Collins from Kaufman Associates was there and recorded the meeting so that, there could be a transcript and a documentation as to what we discussed. So, okay. All right. Thank you, Julie. Rebecca, do you want to talk to us about the grant?
Sure. Basically, the update is, I'm sure people saw some emails going around, and in a very short time, we went ahead and submitted a proposal to what are the HRSA, what they call HRSA development grants, network grants. And they're out of the Office of Rural Health Policy. And the way they work is you have a 1-year planning grant, and it positions you. The main deliverable is to develop a strategic plan for what they call a network. And it positions you to then apply for what they call the network development grants. And those are pretty significant grants that are for 3 years. I think they're around $300 a year. So it's almost $1 million. And about up to 30% of that grant can be used for actual direct services. So they started this planning grants to help rural communities or communities with less resources or capacity, to give them some planning time. And so we did submit that, and the good news either way, the start date would be June 1, so we probably won't even hear anything until May, the way they usually go. But the good part is that now they are doing the planning grants every year. So if we hear that we don't get the award, I think it's still positive, because we would get feedback from HRSA, and also our local state office of rural health would also give us feedback. So that would give us more time, because we essentially did this proposal in about 2 weeks. That would give us time to get everyone on the same page and respond to the feedback that they provide, et cetera. But on the other hand, if we do get the award, it's for 1 year, and we wrote in 3 objectives. One, to do a needs assessment for the tribal nursing homes, hoping to get, everyone's participation. And that was recommended by HRSA as well. And the second one is to help formalize what they call network, for the collaborative. And that's usually things like decision-making in government strategies. Later on, they have networks develop communication plans and evaluation plans and sustainability plans. And the third one was to...
You're cutting out just a little, Rebecca, just so you know, just a little bit. It's a little hard to hear, but I'll recap what you say, so go ahead.
Okay. And the third objective was to do the strategic plan, and we put into the budget travel funds for nursing home facilities to attend a strategic planning retreat. And so that would be based on the results of our needs assessment and other technical assistance. HRSA usually contracts with a technical assistance provider. It's been 2 different agencies that I've been familiar with, and so they often help provide templates and guidance and resources for the network. So basically, it's a year for some planning. and hopefully a strategic planning retreat, and to really get people, maybe do some more outreach and get people involved. And I personally, the Tohono O'odham Elder Care Consortium had a development grant award. They had a planning grant, and then they had a development grant for 1 year. And I was the network director on that one project. And in Arizona, we've had a couple other networks receive planning and development funding. So I'm kind of familiar with the things that they ask for, and the kinds of work that the networks do, and really to coordination, reduce downstream costs, partnering. One of the requirements for these grants is that you have at least 3 entities, and that forms the network. So with our time frame, we just wanted to meet that requirement. But ideally, the network would be all the tribal nursing homes as part of the network, and maybe even another tier of support, like CMS or like the Geriatric Workforce Enhancement Program, who did provide letter of support. So I think they're in pretty good shape, and I'm pretty optimistic. And like I said, they're going to award about 20 or so. I think it's 20 to 25 awards, which is pretty good odds as well. And like I say, if we don't receive the award, we'll have some help and some feedback, and we'll have more time to try and submit again by November, or I guess they'd probably announce it next November, and then it would be due in January. Debbie, I think that's good.
Yeah, can you remind everyone who signed the MOU, please?
Oh, right. So the way we structured it in the proposal was a network planning committee, and so the 3 entities that signed on to be part of that network planning committee was Tonka, is the applicant organization, and Morningstar, Tammy Reed from Morningstar in Wyoming, and also Val with, I don't want to pronounce it wrong, but doesn't even want to help me on that. So those are the 3 entities, and that was really a function of, just time getting the 3 on, and I think it's to be revisited if others want to participate on that committee and sign on. And really the planning year is to figure out, what the network is and what you want it to be, and the vision and the mission and things like that. So more people are certainly able to join on if we're awarded to participate in that planning. And we did get letters of support from the Saley Care Center in North Carolina from Dr. Winchester. And at the last minute, I heard from Oglala that they would provide a letter of support. And we had a letter of support from our state office of rural health. And the state offices of rural health in each state are very connected to this grant mechanism. And in fact, you're required to inform them that you plan to apply. And so we did that. We gave them our abstract, and they gave us a letter of support. So that, I think, helps the proposal as well.
So real quick, did you get a letter of support then from the University of Arizona, the Geriatric Workforce Enhancement Program?
We did. Mm-hmm.
Okay, so I'm just for the minute. So we got a letter of support from Oglala, which I didn't even know that. The State Office of Rural Health, Dr. Blythe Winchester, and who else? Anyone else?
The letters of support were from the Arizona State Office of Rural Health, the Geriatric Workforce Enhancement Program at the University of Arizona also. And Oglala had contacted me that they would provide one, and I wrote it to the proposal, but we actually never got it. So hopefully we'll get one if they ever follow up on that. So we wrote in that they did provide one, but we didn't actually get it into the appendices. And then, Dr. Winchester.
Okay, perfect. Okay. So just to summarize, in case anything that Rebecca Drummond just said, Rebecca and I met her here on the Tohono O'odham Nation. She was for a big HRSA grant, she was the grant director, and Rebecca does amazing work, and I really want to thank her for pulling this all together. I know over Christmas I had to make some connections with Val. They were trying to locate him to do a signature on an MOA because we were hitting a deadline. So the board here has been very proactive and very involved in applying for this grant, and so has Rebecca. So I'd like to thank Morningstar and Val Crail for signing the MOUs because we had to have at least 3 entities. And again, this is a planning grant, and Rebecca, it's $100,000 if it's awarded. Is that correct?
That's right. It's $100,000 for 1 year.
Okay, and so again, if you missed it, we would be doing a needs assessment, we would be formalizing our network, and we would be doing some strategic planning for U.N.I.T.E, which I think we really need to do this because this all kind of started very, quickly, and we're all doing our best, but I think we could use some formalization here. And so I think, again, we'll know by June 1st, and if we don't get it, it's not the end of the world. We can reapply in November, but if we do get it, we can move on to do a development grant. And Rebecca, my understanding is some of that money could be spent on actually providing services to elders. Is that true?
That's right, and that's new. In the past, they were much more strategic and systems-oriented. Now they've increased the budget from, I think it used to be about $180 a year to around $300 a year, and up to 30% of that budget can be for direct services. So part of this planning year is really trying to think, what would those services be, and is it that the network, i.e. U.N.I.T.E, is providing training and professional development, or going to be doing, so the direct service can be patient-oriented, but it can also be professional development-oriented. But up to 30% of the budget could be used for contracts or, whatever the group needs.
And just to clear, a development grant is usually how much money?
The developments are up to I think they're around $300 a year. $300,000
a year for 3 years. Is that correct?
Correct.
Okay. So you guys can see that we're talking a significant amount of money here, and something that could really take this collaborative off the ground and really make it something that I think Kay Branch envisions. And so I'm really hoping that we do get a good result on this. All right, thank you. Does anyone have any questions before Rebecca is finished? Anyone have any questions for Rebecca? Okay, thank you. And now we'll have, it's about 12:30, we'll have Dawn. Dawn, we're going to let you talk about the amazing things you're doing in Fairbanks and how we as a group of tribal nursing homes, what we can learn about connecting in a more positive way maybe with our tribal leadership. So go ahead, Dawn.
Oh, thank you guys for inviting me to be a part of this call-in. I was at the R.J. Hendricks nursing facility before, and I was glad to be welcomed there and felt very welcomed, and was glad to be able to visit with the elders who live there. And I want to congratulate that facility because CMS recognized you for your efforts to include traditional foods into the nursing home setting. Denali Center is located here in Fairbanks, and we're the only skilled nursing facility that really provides care for much of this huge region of interior and northern Alaska. My background is that I work in social services here for the past 27 years. My mother was Denali Athabascan from the village of Rampart on the Yukon River. So I want to share with you what we've done to help Denali Center to be included in a number of, in Alaska we call them Alaska Native organizations. And so our regional corporation is Doyon. It means chief in our language, and that's the organization that's really steered toward all of our members are shareholders of that organization. And then they're the ones who are more business focused and helping our region in the business field. And then we have what's called Tanana Chiefs Conference. So it's a conference of our many village organizations that helps the network to provide services for the areas here. And so as I'm in my office, there is this award that was given It's called the GOP Community Service Award, means like helping others award. And all of the board members of our regional corporation had signed this particular one. And it includes people whose aunties, mother, grandmother, father, different ones who were involved. Their relatives actually have stayed with us through the years. And so really, for me particularly, because I've been at this for this length of time, I personally know and remember them even when they were younger people, before they took those board positions. In the same way with our Tanana Chiefs organization, we partner with our Alaska Native Health Clinic that's next door to us. That is is called the Chief Andrew Isaac Health Center. And I've been involved in training as far as communication between elders and even, because among our staff members, we have non-Native employees. And the same way at the Native Clinic, they have non-Native, like pharmacists and practitioners. So teaching them about how to communicate with their elders so that they're mutually understood. And to where that was really well received. So even when the Tanana Chiefs organization had like a full staff meeting, they asked me to come and do like a presentation, like a keynote speech there. And then after that, they said, Don, we need to record this because we want every employee to hear this. And what I'm saying is my being available to share knowledge that the elders have taught has kind of provided a great network for us. Just one moment. Michelle, I'm sorry. I'll have to get back with you.
Hang in there, guys. He'll be right back.
And I'm actually supposed to be at a meeting. I thought this was starting at 10. And so I really apologize if I may just conclude with a few notes.
Okay, that's
a lot of it has to do with just the investment of the time to network with others. So, like, our elders are involved with, like, we call it a Yukon Quest. It's a dog mushing, so they make blankets for the dogs. And so we're seen like a active part of the community, even though people are living here in the facility. I bring them to like our Festival of Native Arts, so where there's dancing and singing and sharing of cultures. So even our elders, though they may be disabled or in wheelchairs, they're sharing their knowledge in the community that way. I bring them to Alaska Native education with the school district here. So even in our schools, local schools, where they send me invitations, we're welcome to be a part of that. The Natalie Center itself, we have like an infant daycare here. We have children that come regularly and visit. So earlier the question was, how can we instill young people to want to do these jobs? We actually have staff members who grew up visiting here. And we've had doctors in the community that were volunteers here in the past. We bring them to other programs, and even here and then throughout the region, because we are remote, so like even taking them 50 miles away to have lunch with elders in another community is just another part of constant networking to help people feel like we're not just this facility out there somewhere, but we're even a part of them. I hope that's helpful to kind of get some ideas on just the importance of keeping that communication going.
Yes, I'm typing as you're talking.
And if you'd like, how about if I share some of my thoughts on our journey and send it to you, Debbie, and maybe you want to include it in that website?
Yeah, that would be great. So everything from now on that we're talking about on this subject will be all used in our best practice report and when we when we do our webinars in June and July. So we want to share, we want to put something together. And, Dawn, we might look at possibly like Lisa and I were talking about, like maybe a model where it kind of helps people visualize a little bit. Here's all the spokes on the wheel. Here's what makes that wheel really move. And you know what I mean? What are all those things put together that's really going to give you some traction on the road? And so that might be a good analogy to use since we all probably do a lot of driving and traveling.
Yes.
So, yeah, we really appreciate anything you can send us. And I believe, Dawn, that you're still on the list of emails. When I send out that email to TREACH, do you still get those? You should still be getting
I now have a new email, but I've got your most recent one, so yes.
Yes. Can you do me a favor and just text me your current email again? For some reason, it didn't save onto my computer.
I will do that.
I just want to make sure, because I still had your old Banner Health one, so I need to take that off. Yeah, I still had your old Banner Health one, so okay. Does anyone have any questions for Dawn? Because I think he has to go off the call. Joseph, anything?
Just one. Hey, Don, do you guys have a Facebook page for your facility?
I don't know that we really do. I don't believe so.
I know because of HIPAA, sometimes that's limited, but I'm thinking that in the future, if we can get some waivers signed, we should make videos of our facilities to just support each other, because, again, I'll be traveling to Washington, D.C. next month to meet with tribal leadership, and, you know, their plates are always full, but if we could at least have something quick for them to pick up, or maybe for their staff members to pick up that, and I know this is I'm thinking of the future, too, and long-range planning, but again, it'll be great to see a video of your facility.
What meeting are you going to, Joseph?
It's called the executive section of NCAI.
Oh, NCAI. Okay. Yep. That's the one we went with you to last June.
The one you went with me was the mid-year conference up in Spokane.
Right. Is this the disability subcommittee, though, that we were sitting at, or not?
Correct.
Okay.
I'll go ahead and sign off now, but Debbie, I will email you.
Thanks so much. Bye, Dawn.
Right.
Thank you.
Bye. Yes.
All right. So, Julie, are you and Rebecca? I don't know if you need to stay on the call. You're certainly welcome to if you want to. I'm not sure if they're still on the call. Rebecca, are you and Julie still on the call?
I'm still here, but I might get off now.
Okay. That's fine. I think we're going to pretty much wrap up. Honestly, Joseph, I just wanted to hear a little bit on how things went from the last time you called, because you were really concerned about your facility. I just wondered if you wanted to give us an update on that.
Well, again, it's just we're in transition here. We had an interim direct nursing home administrator, and we're desperately seeking a candidate to be our administrator from the local community. And my thinking is, when I go to Washington again in February, is I'm probably going to be recruiting from the other tribal communities in the area for an administrator, because, again, it really makes a difference to have it's important to have a local person in those key roles, I believe.
Yeah, but you're saying you might have to go to another, like a tribal.
Right, in the area, again, we have 20 pueblos in our area and our organization, so, we do have other professionals to draw on, hopefully.
Right. Yeah, and we actually have gone through some transition here, too. We have an interim DON, actually our second one in 2 months, and a contract nurse here. So we've got, and a new administrator last April, so we have a lot of changes also.
I can't remember, Debbie. Do you guys use a management organization?
No, we are under TONCA, which is the Tohono O'odham Nursing Care Authority. So this is basically all tribal members. Frances Stout is not Tohono O'odham, though. She's Navajo, but she's
right. I remember.
She's a chairwoman, and so this group has been from the outset in charge of this nursing home. So yeah, I don't know, Rebecca. Do you want to say? And you know probably more about TONCA even than me.
No, actually, you're right. There's a board, and because there's an authority, they have a little more flexibility with setting their policies and whatnot. They are very proactive and pretty progressive, which is, helpful.
Right, exactly. But they still have to go to, say, the chair of the nation to still, get funding and support.
Oh, definitely, and to all the districts, and they report to executive, but they also report to the districts, and the tribe does fund a significant amount as well. So they're always.
I was just going to say thanks again for your work on the grant proposal, Rebecca. I wanted to say that here at Laguna, our nursing home entity and our tribal healthcare entity are separate, and I've always been proactive towards the joining, the marriage of both groups, because again we are so serving the same people, community members. It's just that our members that go to the nursing facility are older, but again, they fit in that timeline of coordination of care that I believe that we should have for our tribal members. So that's what we face here in Laguna, is that we have separate entities for our delivery of care, and it's at times it's really frustrating because we cannot get our tribal healthcare agency to buy into the fact that we're all one. We should all be one. So
that's very interesting. Because Debbie probably remembers too. When we were HRSA funded on a development grant, one of the partners was the Tribal Health Department, Health and Human Services, and then also Tonka and Indian Health Services and our local community college. And I think we always continue to be challenged with that collaboration and coordination of care. And I think a lot of it's a function of funding streams, for long-term support services and home health, and then the facility. But I think it's interesting to hear something that sounds familiar, and I think that's something that a collaborative can work on. Mm-hmm.
Yeah.
Just to share with you, I was just going to say, to share with you, the makeup of our board of directors is real. It's very diverse, but I'm the only one that really has a focus on long-term care and aging, home and community-based services. That is my background, my work background, and so I'm always educating my other board members about what's possible, and again, or what is really trending as far as services for our elders go. So that's my other task. But it's good to hear that you have that experience also.
Mm-hmm. Those are good points, Joseph, for our best practice report. Needing education about what is trending, keeping up with that, and that might be some work with you're saying NCAI or NICOA or the National Indian Health Board that we need to connect to with those people. So I know they just sent out a white paper on some of the stuff that's happening with the Affordable Care Act. So keeping up with some of that stuff. So we're kind of approaching it together. It's a little bit more of a unified approach, maybe, is what I'm hearing.
Yes, I think so. I'm really hoping that when we do receive the grant, that we will be able to do more outreach on a national level to tribal leaders, because I feel that a lot of times through peer pressure is how we get some of our initiatives met. Sometimes we're so focused in our areas and thinking that, we're not part of a broader scope of tribes that are lacking services, that I think we get too insulated, or we try and keep others out from our little nutshell of information or what we feel is our limited resources, when if we were to band together to pool our resources, we could have greater strength in numbers.
Yeah, I agree. Mm-hmm. Rebecca, do you want to comment on that?
Oh, I agree. I agree as well. It's people have so many duties that they're already doing, and then trying to figure out how to coordinate across agencies is no small task. And one of the outcomes that we wrote into the proposal was this increased capacity of U.N.I.T.E to advocate. And that can be local advocacy to tribal leadership and others, but also, as we're kind of talking here, this is 19 different tribal nursing homes across the country. It's quite ambitious, but I think it's a good opportunity to really think through some of these things and have a direction to go.
Right.
Right. Thank you.
All righty. I'm typing. I love these conversations because there's so many good little nuances and things that come out of this, and so it'll make for good information to include in our papers and stuff. Okay. So I have to admit that since our meeting in Minneapolis, remember how Joseph at the dinner table that night, we all wrote out little thank you notes where they're still sitting here on my desk. That's something I'm still working on getting out. But it's nice to know that the Oglala tribe reached out to us. Do you have a contact for them? Who contacted you, Rebecca? Do you have a name or a number?
Oh, I do, but it's in my email, so I can share it with you later. And I also did want to follow up with them because just so it'd be good to have on our records in case they want to give us the award and they said, oh, you have 2 letters, but there was only one. So I will forward who that person was. I thought it was the administrator, but I don't remember the name.
Yeah, because I'd really like to reach out to them, and that's something I've been meaning to do and just haven't done. So that would be really good. And then, should we do it? Administrators. What?
I was just saying it was good that since you haven't been able to connect, that when you cast the net out to the whole group, that they responded. That was nice.
Yeah, that's really good. The only other things I was going to mention are topics. So we're always going to meet the third Thursday from 12 to 1 Arizona time. I've got Blythe Winchester speaking on dementia on our February call. I've got the T-Tag call is the second Tuesday of the month, and I have been doing those. Joseph, do you want to be on those T-Tag calls too? Because we kind of lost David Hunt and we lost Courtney, so I'm like the only one on those calls. Do you still want to be part of those?
I do. If I recall at the last meeting, you had asked someone to put me on that list, but I never received it. So.
Yeah, I wondered about that because I haven't. I think he's still got. I think I asked John Johns, but I think he's still got. I think he took off Courtney, but I think he still has David Hunt. So, has anyone heard how David Hunt is doing? Didn't he? He had some medical problems.
No, I haven't.
I know that Blythe, since the November meeting, did get off her crutches, so that was good. So I was on the January call, so it was Tuesday, January 10th, and they have the U.N.I.T.E on the agenda now, so it's a standing thing on their agenda. And
Debbie?
that Dr. Yeah.
This is Lisa. Yeah, sorry, I jumped in late because I got messed up by the...
I didn't know you were on the call. Oh, excellent.
Eastern time. But that was one of the things I just heard you mention, that we have our standing meeting time being around Arizona time. But since your time is wonky, can we maybe make it an Eastern, because everybody can kind of figure from Eastern Standard Time?
Right. So so when he sent out the new invite, he just made it for February because the change in the spring happens on Sunday, March 12th, which is like 4 days before our March meeting. So he'll wait and send out the March meeting. So all he sent out was the February meeting, which says 2 o'clock Eastern time. And then when he sends out the March through whatever, that'll be 3 o'clock Eastern time. So you can figure from that. So what John sends out actually is Eastern time. I just got it mixed up. It was my fault. It kind of threw me off because we had our steering committee at 11, and I had 11 in my brain, but we always meet at 12 o'clock Arizona time. So, yeah. So right now the call is set up for 2 Eastern time right now.
Yeah, and I guess it's just confusing because I just see the message from him saying the call is scheduled for 3 p.m. Eastern, but...
That was an old one. He sent out a new one for 2 p.m. Eastern for February, just for February.
Okay. Well, this one's coming out. This is the only one I have from him.
He just sent out a few new emails just in the last hour. One canceled the call, and then one sent a new invite.
Well, I'll follow up just sure.
The one I saw looked fine. It looked fine. So he just sent out the invite for February, and then he'll create March moving forward, and that again will be 3:00 Eastern time, because by March 16th, Arizona and Eastern time will be 3 hours apart again, right? Yeah. Okay, I'm sorry. I know this is really confusing. And then the only other thing, Lisa, that I was going to bring up was when we talked at our steering committee, Lisa and I in the group talked a little bit about involving maybe a few more of the QIOs and finding out who those people were, like who is the QIO for New Mexico. Do you know, Joseph, for your state, who the QIO is?
No, I'm sorry, I don't.
Oh, wait, Lisa, you said it was Health Insights, right?
Yeah, I think my comment was that you're going to need, well, my opinion, I should say, is that for someone, a QIO, to be actively involved, they have to have a pretty significant amount of tribal nursing homes, or in my case, I have, Native elders that are in all of my nursing homes in Alaska. So for me, it's a good fit, but it might not be for, a Quinn or quality improvement organization that's got, 50 nursing homes and only 2 of them are tribal. They're probably not going to have time. But that being said, where we do have those real pockets where we do have tribal nursing homes, it's certainly worth reaching out to those people.
Yeah. Well, I don't know, Joseph, you might see if you can contact your QIO and, for your nursing home, and see if you can come up with a name or a contact.
So each state has QIO organizations, and someone will be assigned to Laguna Rainbow from that office.
Joseph, this is Lisa again. If you want, I can send you the info, and what you'll want to do is just see if there's somebody who's running the same nursing home collaborative down there. If you've got a number of nursing homes that they might be interested in working with in terms of quality improvement.
Would they be tribal specific? Because Laguna is really, besides the one at Crown Point, and there's only 2 of us tribally owned and run.
Yeah, I think that's going to be the hard sell. Like I said, if and I don't know how many nursing homes there are in the whole area, but my guess there's probably a pretty good amount, or would you say no, in your state?
In our state as a whole, I'd say 20 to 30 facilities throughout the state.
Okay, so then if you've got 2 or 3 tribal nursing homes, and do you have elders that are in other nursing homes that are not tribal, do you know?
Correct. We're about an hour away from Albuquerque and about half an hour away from another small city that does have a Good Samaritan Center. And so I'd say probably, 5 out of 60 or 100 residents at each facility is probably tribal or of one group or another, either Navajo or Pueblo. And
okay.
So
you're talking, because now as a quality improvement organization, it's going to be kind of worth my time and energy, if you will, because we're all stretched so thin that if I can't make an impact in that nursing home by helping the tribal nursing group, then I'm just probably not going to have time to do much with the U.N.I.T.E collaborative, to be honest. Like I said, for me, all of my nursing homes have elders in them. 3 out of 18 are tribally run, so I have a pretty good density of that population, so it makes a lot of sense for me to spend time and energy working with the U.N.I.T E group. But it may or may not in your area, and I guess it's worth a call, though. I guess, and that's the point.
I think we, as an entity, as a force, as U.N.I.T E, we definitely need to get on the radar of tribal leaders, because in their planning, in their thought process, they might want to build that facility for Native people. It's not. We have low numbers. The facility that was built at Isleta Pueblo, they have capacity for, I believe, 10 inpatient, 10 persons in their skilled facility, but to this date, I think they've only had one person come in. The others are being taken care of at home, utilizing their home and community-based services. So, again, it's really trying to educate leadership about how we need to work with planners, hospital discharge planners, to get our people into our nursing facilities.
Mm-hmm.
Yeah. I think that's our task. One of our tasks, one of our numerous tasks, is again convincing our own people that tribally run facilities are the best for the people. Well, as I said, I think there's a lot of discharge planners that are unaware that, as in the case of Isleta, they could have placed their people there, but and I don't know exactly what's going on there. It's that perception, I think, in our communities that the nursing home is it's the end of life place. It's not a place to go have fun, which we all know is not the case. So,
right.
That's
so, Joseph, you said in New Mexico, there's not yours is not the only tribal nursing home. There's another one.
I think there's one at Crown Point, New Mexico, which would be under the Navajo Nation.
I see. Okay.
Yeah, it's a 50-bed facility, and it's quite small.
Okay, but is it tribally run, or is it?
I think Navajo Nation runs it. Sure.
Okay, because I'm not sure they're on our radar screen, are they?
Well, you would have think Mr. Wayne Claw would have brought them in, but I'll do a little more research and find out. I'll call the local, and I'll give you an update.
It's Crown Point?
Crown Point, yes. CROWNPOINT, New Mexico.
Okay, thank you. I'd appreciate that. Okay, that's fine. And then, because at one point we did talk about reaching out to, like Lisa, with QAOs, like even though maybe some of these facilities in New Mexico are not quote-unquote tribal, they still have tribal members in them. And we talked about that on one of our calls about still the need to reach out, because these are our people. These are people that need to have the same culturally competent care as anyone else. It's just that they're not here at Archie Hendricks or Laguna Rainbow or whatever. I appreciate what you said.
They need it more because they're not in a pocket of cultural sensitivity, that you've just got a couple elders that are just stuck in a nursing home that's probably not aware of some of the cultural nuances.
Right, and so that's what this collaborative is about. So you would think QAOs would want to hear what we're talking about so they can try to help, whether it's talking to discharge planners or, and I think, Joseph, what you said about we want to be you drive this internally, right? Because we want to be the best we can be. That's what this collaborative is all about. If we're not, then we're going to still have the same problems. People are going to go, well, I don't want to send Mom there. She's just going to die or whatever. So we have to be so good that people want to come.
And I think to do that, you have to really keep that resident focus. How do you give resident focused care? Well, you have to understand the people you're taking care of. You can see where this is going.
Yeah, more
spoken like a true QAO person. All right. Well, so I guess that's all we have time for. Any last minute comments?
Nope. Thanks, everyone.
All right. Thank you for calling back too, Joseph. I appreciate that. And Julie, I don't know if she's still on the call, and Rebecca. Thank you both.
Take care. Bye, everyone.
Okay. Bye-bye.
Thanks, everyone. Take care, Lisa.
Bye, everyone.